Hey guys, welcome back to Lorraine's Lab. Lately I've been thinking about something. Spent some years working in healthcare now, and yet the average person still has no idea what a medical laboratory scientist is. Like when I tell somebody I work in a hospital lab, I usually get one of the three responses. Oh, so you draw the blood? Or wait, hospitals have laboratories? And my favorite, what exactly does a medical lab scientist do? And honestly, I don't blame people for asking, because if you think about the average patient's experience in a hospital, they're never gonna see us. When people walk into a hospital, they're gonna see nurses, they're gonna see physicians. They might interact with respiratory therapists or pharmacists or imaging staff or therapy staff, but almost nobody is walking into the laboratory unless they're lost. Even then, it's usually a higher security area with badge access only, so that people don't come to the lab. Most people are never gonna see the microbiology department identifying the organism causing their infection. They're never gonna see blood bank investigating antibodies before their transfusion. They're not gonna see a chemistry technologist troubleshooting an analyzer in the middle of the night. They're not gonna see a hematology tech reviewing abnormal cells under the microscope. And yet, laboratory medicine influences an enormous portion of medical decisions every day. Which raises the question, why is medical laboratory science so invisible? More importantly, does that visibility actually matter? I think one of the biggest misconceptions about visibility in healthcare is the assumption that invisibility is somehow a mistake. In many ways, the laboratory is doing exactly what it was designed to do. The lab functions a lot like infrastructure. Think about electricity or water systems, internet networks, air traffic control. These are systems that people rely on every single day, but rarely think about it unless something is going wrong. The laboratory works in a very similar way. We are here to be reliable, and the goal is to make sure accurate information reaches clinicians so they can make decisions about patient care. If everything is working correctly, the process feels seamless. A specimen is collected, the test is performed, and results are reported. Clinical decisions are then able to be made. So from the outside, it looks simple. And of course, behind the scenes, we know that there's an incredible amount of work happening with quality control, with troubleshooting, method validations, result verifications, investigation of abnormal findings, interpretation of complex results. Scientific problem solving is a part of our everyday job. Most of that work is completely invisible to patients, and honestly, that's largely by design. The laboratory hasn't always looked the way it does today. Historically, many diagnostic tests were performed directly by physicians. But as medicine advanced, diagnostics became increasingly specialized. Laboratory medicine eventually moved into its own discipline. Testing moved into dedicated labs. Specialized training emerged, technology advanced, automation expanded, and the lab became increasingly efficient. Ironically, the better laboratories became at doing their jobs over time, the less visible the job became. Today, modern analyzers can process thousands of specimens. Microbiology systems can identify organisms with incredible precision, and blood bank instrumentation can assist with complex compatibility testing. So from the outside, that can create the impression that machines are doing all the work for us. But anyone working in the field knows that's not the reality, obviously. So automation doesn't eliminate expertise, it just kind of changes our role of expertise over time. Instead of manually performing every single step of the test, lab professionals become responsible for validating results and recognizing errors, troubleshooting patterns, investigating unexpected findings, and ensuring the quality of everything that leaves the lab. So the work becomes less visible, but that doesn't make it less important. So again, does visibility actually matter? And this is where things can kind of get interesting, because I don't think the answer is as obvious as people might assume. There are a lot of lab professionals, me included, who enjoy the behind the scenes nature of this profession. It's why we chose it. So honestly, I understand that. One of the reasons many people choose laboratory medicine is because it allows us to focus on science, diagnostics, and problem solving without constant patient interaction. So for certain personality types, that's a major advantage of the job. But invisibility comes with consequences to the overall profession. And the biggest consequence is awareness. Because if people don't know a profession exists, they can't choose it. Students can't explore opportunities they've never heard about. They can't become interested in careers they've never been introduced to. And we can't expect them to. And I think that's where invisibility starts to matter. When I think back to my own journey, I spent years studying biology before I ever heard about medical laboratory science. Like, I'm talking all the way to my senior year of college is when I learned about it. And I loved microbiology. I loved infectious disease. I loved learning about how biology influences human health. And somehow nobody mentioned this profession built around those exact interests. It's not because it was intentionally hidden. It's because the laboratory simply isn't a part of the public conversation about healthcare. So when students think about healthcare careers, they usually hear about physicians, nurses, physician assistants maybe, pharmacists, and physical therapists. The laboratory is rarely a part of that conversation because it's largely invisible. Now, whenever people talk about increasing visibility, social media eventually enters the conversation. And I think this is where things become complicated. The goal should not be making laboratory professionals visible simply for the sake of visibility, I think. The goal should be helping people understand what the professional actually does. So helping students discover this career path, helping the public understand the science supporting modern medicine, helping healthcare professionals better understand each other's roles. That's very different from just seeking attention on social media. And honestly, I think responsible visibility is much simpler. It can be as simple as mentorship or going to career fairs and science festivals, speaking to students. It looks like explaining your job when somebody asks. It looks like helping somebody discover a field they may never have encountered otherwise. So those are just small interactions, and they can still matter. Because most people aren't uninterested in science, they just are never exposed to it. I think the laboratory will always remain somewhat behind the scenes, and honestly, I think that's okay. You know, we are a support to patient care. We're not ever going to be the center of attention. But I do think visibility matters in one important way. People deserve the opportunity to know that this profession exists. Students deserve the opportunity to discover career paths that align with their interests. Future scientists deserve the opportunity to see possibilities they may not have considered before. Because sometimes discovering a profession can completely change the direction of your career. And that's something I've been thinking about a lot lately. Because in my case, it certainly did. And that's exactly what I want to talk about in the next video. The story of how I discovered medical lab science, why I almost never found it, and how the experience eventually led me towards science communication in the first place. But for now, I'd love to hear your thoughts. Why do you think medical laboratory science is invisible? And do you think that invisibility is a strength, a weakness, or a little bit of both? Thanks for watching, and I will see you in the next one.